All right, let's talk about how to help a client after their breast augmentation surgery if this client had breast implant illness and went to a plastic surgeon to get an explant. And so this surgery is very involved. They may call it an en bloc capsulectomy, and they may definitely tell you they had breast implant illness, and that's why they went and got the specific surgery. So the surgery itself, the surgeon will remove the implant and the capsule around it. And there's much more information about that in my class. What I want to focus on now is looking at some symptoms, just that brief first look at what is breast implant illness, and then leading us to think kind of out of the box as how can we look at the symptoms, look at what the client may be dealing with before their surgery, what they can be dealing with even after their surgery, and how we as a massage therapist can customize the services we offer, even over and above and around the MLD that we provide them, to make it a more convenient, a more comfortable, a more easy recovery process on the client. So let's start with the facts. So let's look at some facts we get straight from the FDA. The most common symptoms reported to the FDA's medical device report database for patients with breast implant illnesses include fatigue at 49%, brain fog at 25%, joint pain at 25%, anxiety at 24%, hair loss at 21%, depression at 19%, rash at 18%, autoimmune disease at 18%, and inflammation at 18%. So how can we use these symptoms now that we know about them and make the massage and the whole process more easy for our client? It's important to understand because clients who have breast implant removal surgery, because they suspect they have breast implant illness, are going to be suffering. They may very often be suffering from fatigue. This is a client that's going to be suffering from brain fog. They may talk about the joint pain they have, the anxiety and depression that they have. They may have a rash. They may have autoimmune diseases, and they may have inflammation. And though I see so many posts on Facebook about people with breast implant illness experiencing this rapid reduction in their symptoms as soon as they have that implant and capsule removed, us as massage therapists still need to prepare to provide support for clients who don't experience this quick miracle cure that happens within days to a week after their plastic surgery. So what are some ways that we can think out of the box and provide really good service to these clients, knowing some of the symptoms that they may be experiencing because of breast implant illness? So if we're helping a client that has fatigue, it may mean scheduling the appointment at the time of day when they have the least fatigue, or maybe offering in-home services if that's more convenient to them. If they have brain fog, that may mean that the client needs additional reminders for their massage sessions. And I even had a client kind of laughingly, jokingly, but not really jokingly, tell me that it would be so convenient if I actually texted them the time that they were supposed to leave for their massage, so they knew when to leave exactly for their massage. So this is up to you as a practitioner. How hands-on do you want to get with really supporting them through this brain fog symptoms that they're having as a result of the breast implant illness? We may see medications for anxiety, depression, and autoimmune diseases on their health history forms, and we may see a rash that they've had for a long time on their body as we're giving them the massage. So just to know that this rash may be because of their breast implant illness symptoms. And they may complain of inflammation and joint pain. So to know all this, to know a little bit more about breast implant illness and the most common symptoms of breast implant illness, gives us some of the tools and knowledge we need to kind of have some foresight and think creatively on how we can use the knowledge that we now have to customize, to make the practice of getting post-operative massages easier, more convenient, and more beneficial for the client as they're going through their healing journey from breast implant illness.